Hey everyone, Dr. Buffy here. And today I just wanted to give an updated post. It's been a while since I've made a video, and I've gone through so much in the last year, and it's really time to get back out and provide more content to you and to my followers. And first of all, I just want to thank you so much for your support over the years, really, for everything. This last year has been really devastating with the loss of $8 billion in public health funding. I had to pretty much let my entire team go. And we're just waiting to see if some of that funding can be restored. We do have some funding that we're able to provide nursing home support, but it's very, very small. And so we just keep moving, right? I started this company in IPCWell in 2018 and didn't have any funding then. And, we just keep going. And also I started medical school to expand my knowledge and education, because while I have a doctorate in public health and a specialization in epidemiology, I really felt that longing to be able to help in even more of a clinical setting. I mean, I come on site to vulnerable populations all the time, and my knowledge can only take me so far. And truly, it's been a dream of mine my entire life to be a physician. I actually started at St. George University in Grenada in January, completed my first term in May, and then had the absolute awesome privilege of going to Kenya, Africa, and working in a hospital there, and having just be able to meet the community of people there. And it's just, there's a link to I made a video that's also on my page, check it out, of the experience that I was able to have. So what I want to talk about today is some pretty exciting new information. First of all, I'm in Detroit, Michigan, one of my favorite places. I actually was able to provide 2 different site visits yesterday, and I have 2 more today. I'm going on site as a grant that I have through the Michigan Hospital and Health Association, and we're working with nursing homes in Michigan, in the Detroit region specifically, 10 different nursing homes, with helping them prepare their facilities and implement enhanced barrier precautions and preventative strategies regarding the infectious disease of Candida auris, or C. auris. It's a fungal pathogen, and it's one of the multi-drug resistant organisms. And we are working to help these nursing homes feel comfortable accepting residents that might be colonized with C. auris. We know that it can be, it is an emerging pathogen, so it can be a scarier thing to accept. However, I like to let folks know that, this is the same way we felt about MRSA when MRSA started coming into our facilities. And then, of course, different organisms, carbapenem resistant Enterobacteriaceae and CRE. And so we want to feel comfortable and confident and have the education to accept any resident that needs the care in our skilled nursing facilities or long-term care facilities. And so this is the education, and I'm so grateful that this funding wasn't cut, that we are still able to offer some support to these vulnerable nursing homes that need support, that need guidance, that need assistance. They're showing up every day. I love working in long-term care. The healthcare workers, they show up every day. They're dedicated, and oftentimes they just don't have the resources. They don't have what they need. I continually petition to our government for those grants, our state health departments, our federal government, to be able to provide the grants and restore the funding to support our public health. So we're able to help these nursing homes. It's been wonderful. I will do more posts about what that education entails, so that clearly, if we're not helping your facility, you can still get some of that education, because what's happening is that patients in the acute care setting or hospitals may be colonized with Candida auris, And then the nursing homes or the skilled nursing facilities, they may not feel comfortable accepting that resident into their facility because they're worried about the spread of this pathogen. And so then what happens is the patients stay longer in the acute care setting, and they're backing up. They're holding onto those beds that really need to be for more of that acute care patient, the higher acuity. And so I will continue to post information about how you can feel confident in caring for your residents that may be colonized with C. auris. It's really very much along the same lines as everything with enhanced barrier precautions, which is also very unique to long-term care. And, it is my hope that you feel confident in what your infection prevention and control practices are, that you're not worried, that you're not worried about the spread. And so this is an emerging pathogen. We want to get in front of it. We want to be proactive, not reactive. What we don't want are massive outbreaks, right? And so that's where education, preventative practices are very important. And I'm excited to be able to continue to bring you that education and information. The other thing that I want to talk to you about today are the new guidelines from the American Urinary Association, the AUA. If you have not heard about this, and you may not have, these new recommendations came out about 2 months ago, and they're basically new guideline recommendations for treatment for genitourinary system. And what this is a collective force that has been taking place. Many different associations came together over many years to get these recommendations changed. And where I really want long-term care to focus on are the new guidelines for recurrent urinary tract infections. In fact, just yesterday, I was on site at a facility that let me know of a resident that has recurrent urinary tract infections. And this poor woman is on antibiotics constantly. When we know the dangers of being on antibiotics all the time, we have antibiotic resistance, which is leading to these multi-drug resistant organisms. We have the opportunity to reduce the harm of these urinary tract infections, reduce the harm that it's causing for our residents, the antibiotic resistance, and then the onset of these MDROs. So please check that out. I'm going to provide the link to you below so that you can use this. Please, I'm begging you to download these new guidelines, provide them to your clinicians at your long-term care facility. This is going to save lives. It's going to save hospital visits. It's going to save people from dying of urosepsis. This is so important. So if there's anything you heard from me today, it is to download those guidelines, provide them to your clinicians so they can start looking at alternative ways to prevent urinary tract infections. We know in long-term care, UTIs are the number one reason for hospital readmissions. We can do something about that, and we can do something about that together. And I am so excited about this. IPCWell is still here. We are moving forward. And if you would like to have us come on site at your facility or work with you in any capacity, please let us know. We will do whatever we can to make that happen, because we absolutely love working with long-term care, vulnerable populations. We are here to help you and here to support you. Lastly, please like and subscribe to this channel. It is my goal to grow this channel and to grow the information that can help our elderly community, our vulnerable communities, our under-resourced communities with infection prevention, for quality of care, quality health, And I already know, even after one term in medical school, with my combination of public health and epidemiology, you're going to get so much more information and so much knowledge, and knowledge will equip us to make those better decisions, right? And to be able to go to our practitioners, to go to our healthcare providers and partner with them with the information that we need to advocate for ourselves, to advocate for our loved ones, and for better health. And there's new research and there's new evidence, and we need to bring that forward, and we need to have those discussions. So I'm going to help you do that. Okay, so don't forget to like and subscribe, and we'll talk to you soon. Bye for now.